we're going to take the first one by Dr. Olisa, consultant psychiatrist. Please, a round of applause as it comes.
Good morning, the head of clinical services and also the chairman of the Good Clinical Governance Committee, secretary of the Good Clinical Governance Committee, other members of the Good Clinical Governance Committee, and our quality officers. We are welcome once again to this program where we will talk about quality, how to offer care to our patients, care that is acceptable, care that is up to the standard, meeting up their expectations, and also conforming to our professional standards. When we talk about quality, it's not something that is abstract. It's something that is practical. We are talking about lived experiences of our patients in our hospital. How the patients feel about the services that we offer, their perception about the services that we offer, and based on our local context. That is what we are going to talk about today. It's very important. In fact, we're actually a privileged and select group of people. It means that the hospital expects a lot from us. We are supposed to be at the helm of affairs when it comes to coordinating services. We really have to pay attention to all the discussions that will go on today so that we arm ourselves with the information that we need to be able to offer acceptable care, and also to encourage other people that we are working with to be able to do the right thing. And all this will be aimed at improving patient satisfaction and also improving the image of our hospital. I want to start, just like the head of clinical services said that it's supposed to be interactive. I want to start by asking us a question. If we have a family relative, a son, a daughter, a parent, or even us, anybody can fall sick, and we direct the person to come and see a doctor or maybe to come and access care in this hospital, what do we expect? What are the things that we expect? Because we want to bring down the concept of quality to something that is relatable. What do we expect? Do we have answers? Don't look at what is projected there because it's already there. I just want two persons. What do you expect? The environment, just like Anibo Ade says, that the eyes will first of all eat before the mouth. How the environment is it up to standard? Is the environment clean? Of course, that is the first impression. There's a kind of hospital you come into, or maybe you're inside the hospital, you come into the OPD and everywhere is scattered. Already, you're negatively biased. You're talking about the environment, how clean the environment is, how the person is received, is there long waiting time, or is the person going to be attended properly? What you expect basically is to see a clean environment, an organized environment. You want to be attended to timely. You want the right diagnosis to be made. You want the right treatment to be given. You don't want any adverse effects or preventable adverse effects. It's a totality of the expectations that we want when we come to a facility like this, or that we want the people that will refer here to get. That's what quality is all about. Let's not take it too far. Just like when you go to a market, you want to buy something, you're looking for quality things, quality shoes. You have an idea of how something that you want to buy should look like. That's what quality is all about. It's about the care that our patients expect, and again, being able to meet up with the standard that our patients expect, and even exceeding it, meeting up with the expectations and exceeding it, and also meeting up with the standard set by our professional bodies. We are drawn from different departments. We have the doctors, we have the pharmacists, we have the lab scientists. These are professional bodies. And before we reached to this point, we went to our schools, we wrote our professional exams, and we have set standards. In fact, if you don't pass the exams to test whether you have really acquired a standard, you won't be where you are today. Another part of quality has to do with meeting up with the standard that is set by your professional body. It's not just about meeting the patient's expectation or exceeding the patient's expectation. The quality of care that you offer should also be viewed from the lens of what is acceptable. What it means that you have to be up to date to be able to offer acceptable and qualitative care. So that is what quality is all about. So why do we talk about quality at this particular point in time? The dynamics of our society is changing. Our patients expect much more from us, the care providers. People having access to the internet, they have access to the social media, they have an idea of how care services work in developed climes, and they want the same thing replicated. And if some of them who might be troublesome, if you don't meet up to that expectation, you see them, they take to social media. For some of us who have been following trends in social media, recently there was a particular hospital in Enugu where a nursing student was seen videoing where they were operating with torchlights and all that. And of course, the video went viral. In fact, they even had to drag the governor into the issue. What it means is that we really need to be sensitive. Because when the chips are down, maybe there are lapses, everybody will deny you. So expectations are high from our patients. They know what should be done for them, and if these things are not done, they start to protest. And again, we also know that our regulatory bodies are expecting much more from us. Nobody wants to lose their office. We have the Federal Ministry of Health, we have the National Health Insurance Authority, Medical and Dental Council of Nigeria. All these regulatory bodies, they are increasingly demanding much more from us, the service providers. Because at the end of the day, if there is a mistake, you don't know where it's going to be escalated. So everybody is trying hard not to be found wanting. And but at the end of the day, we have local realities. What are the realities? There is rise in population. Our population is rising. Patient load is increasing. Just like this place was converted from General Hospital to Federal Medical Center. Of course, it has projected the name of the hospital. We expect that more people will come just because of the name Federal Medical Center. They have to see patients pooping in. And at the end of the day, the reality on ground is that Nigeria has happened to many of our health professionals. Many have left the shores of the country. The few that are remaining are being overwhelmed. But how do we embed quality into all these things? Because when a patient comes to see you, he has paid for the services. He wants the best. He doesn't want excuses. We know that there are realities. Some of these things I've mentioned. We are understaffed. The patient load is much. The waiting time is crazy and all that. The patient doesn't want to hear all those things. The patient wants services. How are we able to embed quality in what we are doing in spite of all these challenges? I don't know whether we are following me. Yes, in spite of the challenges, yes. Patients expect much more from us. Regulatory bodies expect much more from us. But reality is not, we have challenges. At times it may be light. You want to perform an operation, there is no light. These are realities. They will tell you the generator broke down. They will tell you that the federal government has not approved. These are the realities. But at the same time, as members of the Clinical Governance Committee, as quality officers, in spite of these challenges, we are still expected to offer minimum acceptable care to our patients. Safe care to our patients, such that the mortality rate will decrease, if you see this graph that I projected, a lot of our health indices are not the way they are supposed to be. The maternal mortality rate is increasing, infant mortality rate, and so many other indices. So how do we embed quality into our practices such that we'll be able to, at least somebody will say, these people are trying. They are trying in spite of the limitations. Let's go back to our definition of quality. One of them says consistently giving care, consistently giving safe, effective, respectful care that improves patient outcomes. The other one says the extent to which health services increase the likelihood of desired health outcomes. We've already explained that. Just like the mantra, this mantra is about doing the right thing at the right time for the right patient in the right way consistently. Doing the right thing means offering the acceptable care, effective care, the care that you're supposed to offer. Just like we explained it, that we all have to upgrade ourselves to be able to make sure that the care that we are offering is up to standard. That is doing the right thing at the right time. Now, you might have all the resources, you might have all the trainings, you might have all the facilities, but if you're not available to offer that care at the time that you're supposed to offer that care, you see that it becomes useless. As quality officers, as members of clinical governance committee, we have the responsibility of making sure that people are at their right places of where they are supposed to be and offering the care that they are supposed to offer, the time they are supposed to offer the care. Just like maybe you have accident victims being rushed to the emergency and they arrive at the emergency, no house officers, no nurses, they are late. And before they arrive, maybe some of them would have given up the ghost. You see that definitely affects the care. For the right patient, and the right way. The right way means something like standard operating procedure. Every department has to have a standard operating procedure. You have to follow the protocol. It's not about what you think. It's not about, oh, this is the way we do it. The question is, the way you do it, is it still something that is standard or is it outdated? And again, consistency is very, very important. Consistency. You might win the staff of the year in a particular year. Everybody will clap for you. You are wonderful. But the question is, are you going to maintain that? Are you going to maintain? It's about consistency. That is what improves the image of the hospital. In a situation whereby every time new patients come to the hospital, they have bad experience, and that is repeated, of course, definitely it's going to affect the image. It's possible that those people that had some limitation in care might have been good at some point or the other. But the question is, are they consistent? Consistency is one of the key ingredients of quality. Now, remember we have like 3 presentations. So, and just like we said, there is need for us to understand the concept of quality, what quality is all about. In fact, when I was asked to do this presentation, I was like, quality, what am I going to say? I know that many of us might have been in that kind of situation. You must have been hearing quality control, quality this, quality that, quality management to serve as something very big. So our aim is to be able to break it down such that every member of this group will be able to understand it. And now there are 2 models for understanding what quality is all about, for explaining and implementing quality. So one of them is Donabellian model. The other one is stick model. We're going to look at that after we finish discussing this one. That Donabellian model is just a group of researchers that found out these 3 critical components of quality. First of them is structure, process, and outcome. What is structure? Structure is about the physical nature of where care is given. Just like we said, that, of course, when a patient is coming to a hospital like this, the first thing that he sees are the structures, the buildings. They have necessary, structural facilities, departments, and all that. That's the structure. Then, when you come to structure, you have the components. For instance, in the lab, you don't have the necessary equipment, apparatus, reagents. In the pharmacy, you don't have the stock of the drugs, or because there are some pharmacies that you come to, many drugs are not there. So it's not, but the department is there. So these are the physical things. Then you also talk about things like electricity, water, theater, basically the equipment, the facilities in the hospital. That is the structure. And of course, structure is very important because you, just like somebody who is going to work without who, there's no way you're going to farm now. It's a waste of time. Structure is very important, but it's not just about structure. It's about how the structure is working. It's about how service providers are using the structure to be able to offer care that is qualitative. I give you a typical example. Maybe, of course, we've heard such stories of when maybe a surgery is going on and suddenly maybe the generator breaks down. And there is no power from the national grid. What we expect, and maybe it's at night, and important surgical procedures are being carried out. Maybe borehole surgery, eye surgery, all these delicate surgeries that you really need vision. You can imagine what is going to happen to you. Definitely quality is going to be affected. When you talk about quality in this scenario, we're still talking about structure. It is the responsibility of the quality officers, of the good members of the Good Clinical Governance Committee in association with the hospital management to make sure that things like that do not happen, to have alternative plans. For instance, maybe I know that in this hospital they have more than one generator. So that's a quality assurance such that if something happens to this, this particular one we used to use, another one can be used. We have a reservoir of fuel, because at times, just like the scenario I created, a surgical procedure is going on and suddenly the gen goes off and it's in the middle of the night. So if you don't have reservoir of fuel, you can't get fuel because all the police stations would have closed. It's about trying to make sure that you have things are planned in such a way that emergency can be attended to. Having a kind of backup, making sure that if there is a temporary hitch, based on the backup that is available, to be quickly sorted out so as to decrease the chances of having affectation of quality. Just like I said, structure is about the facilities, the container, and the idea that all these things have to work properly such that there won't be service disruption, which definitely will affect quality. Then the next one is process. The process is about mainly workers. How do the workers make use of the structure? How do the workers make use of the facilities that they have at their disposal to be able to offer acceptable qualitative care to patients? Are they doing what they are supposed to do? Do they come to work early? Are they following a particular guideline in treating patients? So it's about following due process, even in the face of difficulty, even in the face of pressure. For example, those that are in maternal health, when pregnant women come for labor and delivery, there are certain basic things that are supposed to be done. We need to monitor their vital signs. We need to open what they call pathograph to be able to find out how labor is progressing. These are part of standard operating procedures. But you see that because of certain challenges that we might have, maybe shortage of staff, and for instance, maybe a doctor is in the O&G ward doing call, a young doctor, and you have like 10 pregnant women coming at the same time, some in different stages of labor. you see that at times laid down principles and rules and protocols people might not be able to meet up because of pressure. But at the same time, quality should ensure that minimum acceptable standard is given. Minimum acceptable standard is given. There's something they call triaging in care, delivery of care. Triaging is like maybe many accident victims are brought to the hospital at the same time. Many are different levels of injury. Some have head injury, some have broken arms, some are disable. Triaging has to do with you have to separate them based on their severity levels. Just like the example I gave, a young doctor who is on call and you have a barrage of pregnant women who are at different stages of labor. Quality still has to do with, you might not be able to attend to all of them at the same time, but at least you have to find a way, use a metric to find out those ones that need urgent care. There are some that need more urgent care than others, so that you're able to save their lives. That is about process. Now, outcome is about a combination of structure and process. How do you use the things that are available to you to bring out good outcome, to bring out good results? Outcome is very important. When we finish speaking all this grammar, what still matters is our patients responding, what is their readmission rate for people that have chronic disorders. Is it after discharge, maybe you just discharge somebody today, and the next 1 week the person comes back. So outcome is very, very important, and of course outcome has to be measured. It's not something you guess. It's not something, oh, we are doing well, our patients are recovering. What is the data? Data is very, very important in quality management. Things have to be documented. It's when things are documented that when you go back to revisit them, you look at the picture, and it will inform you whether you're winning the battle or you're not winning the battle. This is about Donabedian model. Now the second model is STIP model or STIP framework. STIP is just an acronym. You can see that there. You see safe, timely, effective, efficient, equitable, and patient-centered. These things are part of the things I was previously explained, but we'll still have to go over them so that we're able to understand quality more clearly. Care that is offered must be safe. Must be safe. Safety is very, very important. Just like in our principles, there is this medical principle that we call non-maleficence. What it means is do no harm. Whatever care that you're offering, do no harm. It will be very laughable that a patient comes into the hospital, maybe for a minor ailment, is being treated, for instance, for malaria, and by the time you're discharging the patient is going home with hospital-acquired infection. Things like that can happen. Things like that can happen. It is about safety. How is the environment in which you're offering this care? Is it safe? Is it clean? Are you following the protocols? Are the drug dosages right? Or are they capable of causing harm? Making sure that care is offered, effective care is offered in a safe environment, in an environment that is not going to worsen the patient's problem or cause additional harm. So that's about that. Examples are things like hand washing, correct dosing. That's a very important pillar of quality. Then the next one is timely. Care has to be timely. Care has, just like the illustration I gave, you might have all the expertise, all the facilities, but once the staff are not there to offer timely care, you see that the whole thing is made mess of. I give you a typical example for people that have stroke. When somebody is hurriedly brought to the hospital and the person is being suspected of having stroke, there is this investigation that doctors normally request for, a CT scan, to find out the kind of stroke it is. And it's something that has to be done in a timely manner. Doctors need that investigation to be done and the results given to them so that they will be able to make that decision. You see that, for instance, if a patient is wheeled in and maybe the technician is not around, or maybe there's a minor fault and there's nobody to take care of it, and it prolongs the time in which the person is going to get effective care. And at the end of the day, by the time even that test is done, it becomes useless, and definitely that affects the quality, overall quality of care that patient is going to get. Now, care has to be effective. It's just like I said in the beginning, that each and every one of us has to make efforts to improve ourselves. Self-capacity building. Yes, hospitals usually sponsor staff for trainings and retrainings, and all those things are fine. But when you look at the situation in the country, they will always tell you no budgetary allocation, this and that. It's your responsibility. You have to make certain effort to improve yourself. Go for programs, read books, such that you'll be able to be at your best when you're offering care, so that any patient that comes in contact with you would actually be touched. Don't do things that can make it a point of duty that any patient that passes through you would really be touched. And how do you do that? By offering effective care. The care that works. It's not all the treatment that works. It's not all the care that works. And how do you give evidence-based care? By upgrading yourself. It's not about, this is the way we've been doing it. It's not about, that is the way I was taught. Remember, medical practice, health practice is something that is dynamic. People always come up with newer insights, better insights, research findings. So if maybe you're exposed to better ways of doing something, you have to imbibe it, provided it's documented, provided it has evidence base, such that you'll be able to offer effective care. And of course, as members of good clinical committee and quality staff, we also have to ensure that people are doing the right thing by using things like standard operating procedure. Now, efficiency is about being able to use minimum resources required to achieve something. Yes, the difference is that, yes, you might be offering effective care, but it's taking you time. You're not doing it efficiently, or you're incurring wastages. Yes, the care that you're offering, but at the end of the day, maybe after treating a patient, the patient would have sold all their belongings and even gone and borrowed. That's why some people run away from tertiary care centers. You have all manner of tests, you do this, you do that. Yes, those tests might be right, but the reality is that we're in a resource-poor country. So it's still our responsibility to ensure that wastages are done. I had experiences where patients come into a particular hospital, may have done some tests, and the patient is still asked to repeat it. It's true that we might not really believe in some of the validity of some of those tests, but when we are doing all these things, we should also know that these patients might not be able to afford all these things. At times when they finish doing tests, even they wanted to buy drugs will not be there. That's about efficiency, achieving the same results in a faster way and reducing wastage and unnecessary interventions. Now, care should also be equitability, equality. Hospital services is not about, I know this person is my colleague, this person is a rich man, this person is an important person, you begin to look at several things. No. There should be standard way of attending to patients, maybe first come, first served, or based on certain criteria like I explained. Triaging when you have emergency. So it should never be based on certain kind of favoritism. Because one fact, I give you a typical example, when I work in the mental health, when you come to our clinic, you see a lot of people, they usually come very early and they are given numbers. Won't be tied to, even if you're a staff of the hospital and you try to do mago, they will descend on you and nobody will save you from them. Because nobody likes to be cheated. Nobody likes to be cheated. If a patient feels cheated, he will never say any good thing about that hospital. Then the next one is patient-centered care. Of course, we don't need to be reminded of the fact that we are here for the patient. Without the patient, we won't be here. No matter the position you're holding. If there was Nothing like this hospital, FMC Onitsha. Probably you and I wouldn't be there. The patient's care should be paramount. Making sure that the patient is given acceptable care should be paramount. And there is also something that I want to bring out to explain this. Communication. Communication is very important. Effective communication. Just like we said that there might be challenges, there might be long queues, crowd and all that with minimal manpower. So if there are inefficiencies, if there are limitations, or maybe you come to work late, you have to apologize, you have to explain, please. So, because when a patient, it's just like when you pay for services now, when you pay for services, you want the service to be given to you. You don't want stories. No matter the challenge that the service provider is having. Just like people are crying now that when you load data, before you know it finishes. People are even protesting and saying they should shut down MTN. They might be having some challenges. Remember that these people are getting their money from foreign currency. Our currency is already watered down. They might be having some real challenges. But as a service consumer, you just want the best. You don't want to hear that. That is also the way that service consumers, that's our patients and their relatives, when they want, just like I asked you when we are starting, I asked you, which kind of care would you want to be given when you are sick and you're brought to this hospital, or maybe you recommend somebody to come to this hospital? Of course, you want everything good. That is the same way that they want to be treated right. And if there are limitations, which is understandable, we're in Nigeria, you have to be seen to explain, not shouting back. We're trying to round off now. Now, when we are talking about quality, there are terms that are associated with quality. There are terms that are associated, and it's good that we throw more light on them. We have quality assurance, quality control, quality improvement, quality management. Of course, quality assurance is about, just like the name, is making sure that the right thing is done, making sure that we use the right processes based on the structure that is available to us to produce good results. The process, just like we mentioned, things like standard operating procedure, staffing, all these things are the things that ensure quality assurance. Then you also have quality control. Quality control is about detecting errors, because errors and malfunctions can make service delivery not work the way it's supposed to work. For instance, a typical example, in a pharmacy, you might have stocks that are expired. So if you don't frequently, maybe on monthly basis or weekly basis, check the stock that you have, you see that error can be made. Drug that is expired can be dispensed to the patient. For the same thing with you check for the reagents, as they expired, you check for the apparatus that they use, the equipment, is it well calibrated, does it need to be recalibrated to be able to give you the results, a sensitive and specific result. Then you also look at waiting time, something like waiting time. That's why I said that we cannot do anything without data. Data is very important in quality. If you have, for instance, you have the data of waiting time to see doctor at the OPD, look at it, maybe you see like 4 hours, 5 hours, it's an error that has to be improved upon. You go back to the system, you go back to the drawing board to find out if there is a way you can shorten this. That's what quality is all about. Then you also have quality improvement. Quality improvement. So whatever you find out in quality control, you can improve on that. You can readjust the system to be able to make sure that thing is handled and better quality is given. Now, total quality management. Total quality management is just an embedded culture of quality in every fabric, in every system of a hospital to make it functional. And the concept of total quality management is about when a patient, from the time the patient comes into the hospital, to all the departments that the patient is going to pass through until the time the patient leaves. At every point in time, at every segment, the right thing has to be done. Quality has to be ensured. Quality is something that is global, is not specific to any department. All hands must be on deck. so that quality can be assured. I give you a typical example. Maybe in the records department, at times you go there, you see crowd. In fact, there are even cases where a patient might wait and even leave. Or maybe if they now wait till maybe around 3 or 2 before their folders are brought to the doctor. Even the doctor is even tired, and the chances of errors will definitely increase. Maybe wrong prescription will be given, or maybe at the pharmacy the person that is dispensing might even dispense a totally different drug, and you see that one mistake in a particular place might spiral and give unexpected and unacceptable outcome. I've already discussed all this, that the core principle of quality, that the patient is at the center. Patient is at the center. And of course, the need to use data. Another thing is leadership. Leadership, you cannot talk about quality management or quality control without talking about leadership. If the leadership is weak, then quality cannot be ensured. It's just like, I don't know how it happens here. As a member of Good Clinical Governance Committee, maybe I understand that from time to time we go for ward rounds and all that. Some people might not like you, they might not like your face. They might say maybe to give us query and all that. You must face challenges. Anytime you're in any position of leadership, you don't expect people to clap for you. The most important thing is that the right thing is done. And of course, this is very sensitive. It's not just about even you can be a victim of non-functioning system. That you're a health worker does not mean that you are immune to illness. What happens if something happens? We are not praying for that, or maybe somebody collapses and you are supposed to be cared for in the same hospital where things are not working. It's that you are affected. It could be your relative. What it means is that when having been given these positions, we really have to discharge our duties without any fear, because you might be affected. Leadership has to be strong. Leadership has to ask for accountability from staff. Yes, the proper thing has to be done, and people who are found wanting in 1 or 2 things that are not acceptable, they should be asked to explain. And if punishment is supposed to be given, it has to be given. But the problem that we have in this country is at times when you want to do some things, maybe somebody that is higher than you, maybe you receive call from Abuja, leave that boy or else and remove it from that. You see, these are some of the challenges, and that is why our society is not working. Leadership is very important. Just like we are doing form of training now, of course, is leadership by the management that made that possible. Leadership has a role in training, equipment, and accountability. Very, very important. Strong leadership, there cannot be good quality or good quality management without strong leadership. Then, just like I said before, everyone has a role. Is a teamwork. But as leaders in this area, people are looking up to us. Just, one of the things that we discuss is timely, that qualitative care has to be timely. And we overheard the head of clinical services say, we shouldn't be coming to this kind of program. We are quality officers, where people are looking up to us. We have the change has to start from us, so that it will now be propagated down to people who look up to us. So that when you're correcting somebody, the person will not come back and say, this is not this person. When do you usually come to work? And that's why at times it might be difficult for people to effect some of these things, because they have their own deficiencies. You first of all remove the speck in your eye before looking for someone else's one. Everybody is important. It's a teamwork. We cannot do it alone. We have to encourage others to do the right thing. Just like I said, non-functional system, dysfunctional system can happen to anybody. It can happen to anyone. It can be you, it can be your sister, it can be your brother. And by the time that dysfunctional treatment is given, or the person does not receive the care, of course, you know that you shouldn't blame anybody, because you're part of the reasons why the system is not working. As we are concluding, what are some of the challenges that might impact on quality? Poor documentation. Many a time in establishment like ours, people see things that are not working and they keep quiet. they assume that those in office, in high offices, in leadership should know. Don't assume. You might be in your ward, maybe the stick is not working, thermometer is not working. I know they should know now. The head of clinical services should know. You have to document it. Or maybe there is an adverse drug reaction, or maybe whatever it is that is unusual, document it. And not just document it, communicate. Communicate. And when you communicate, most times you have to send reminders. Because see, those people at the helms of affairs, it's not easy. It's not easy. They have a lot of things to sort out. Don't say, oh, but I have written. They didn't do anything about it. Make efforts to send reminder. These are very important ways where quality is improved, things that are not working right is pinpointed, and corrections made. Then resistance to change. People are usually, they are used to certain ways of doing things. Just like I said, that's what we are doing it. That's what they said. No, that's how that's where the people that need this and that. Being resistant to change is one of the things that cause quality not to be improved. People are resistant to change. When you're telling them, no, this kind of practice is no longer acceptable, things have changed, look at the better ways, and they see it, they still are resistant. And of course, if you're resistant to change, then you see that quality will never improve. And that will discourage people, potential service users, from coming in because they haven't seen any changes. Now, reactive approaches. We have to make sure that the system is working in such a way that you don't need to wait for an error to be made. Maybe I give you a typical example. A lab technician brings out lab result that is not good. As a doctor, you're looking at the patient. The clinical findings are not in tune with what the lab is saying, and maybe you request for a second opinion, and the test result comes out to be different. What are you going to do? The tendency is to start to blame. This person doesn't know what he's doing, this and that. Maybe the person will even receive query. The person might have it, but we have to look at the system. Is it possible that the reagents have expired? Is it possible that the equipment needs recalibration? Is it possible that this person needs supervision? Look at some systemic things that might have caused that error to occur. And when you are tackling the error, you're also tackling the systemic failure that led to that error. That is being proactive. I think I have to round off. What are our take-homes? Quality is everyone's responsibility, not just clinical staff. Quality can be measured. What we measure, we can improve. Quality is a continuous journey, not a destination. We keep on improving. There is always room to continue to improve. There is no destination. The destination is more improvement. We keep improving ourselves. And good quality care saves lives and builds patients' trust. And the final thought, let us make FMC Onitsha a place where every patient receives the same quality of care we would want for our own mother, wife, or child. Thank you.
Thank you very much, Dr. Olisa, for this wonderful presentation. My ears are not bigger than yours. Quality is a continuous event. Consistency, not that you did it today, what of tomorrow? Consistency. And the services must have high quality standard. That is take home. Do to others what you want them to do to you. Let us give him another round of applause. This is